I want to thank every one of you for your support towards the work of the Commission. And I want to thank you again for participating in this brief report on the achievement of the Commission. At the very beginning, I promised two things. One, it was to save as many lives as possible. And secondly, to make sure that every single dollar, the dollar that you contributed to, will be accounted for. And I think we did both. First of all, to save lives. We had to identify patients with COVID-19. We could not just identify them clinically. We had to do a laboratory test. Early on, there were only two laboratories that had all the platforms to do PCR tests. And it was the National Laboratory and the Guescio Rodolphe Mérieux Laboratory. So those labs really worked beautifully together. We shared every single thing, and we continue working together. I'm very happy to report that now we have 13 labs nationwide capable of making the diagnosis. Now, once you make the diagnosis and the patient tests positive, you have to be able to manage that patient. In order to do that, you need to develop guidelines. So we developed guidelines for both home care and care in the hospital. We also had to train staff. And over 1,000 people were trained, most of them at Guescio. And those guides also were also originally produced by Guescio and reviewed by the Commission. And they can be seen online. Now, after we trained the staff, we had to set up centers. In the beginning, there were only 4 centers. We're now into 43 centers. And those centers are fully capable of handling COVID-19 cases. They have a well-trained staff, and they are fully equipped with PPEs. Some of those PPEs are produced in Haiti. Those produced in Haiti have the advantage of being washable up to 10 times, which is very important and produce an economy of scale. In addition, we have oxygen available, blood gases, X-ray machines, all things that were not available previously. We have obtained 23 oxygen generators from China, France, and Portugal. They are all in operation in Haiti, and the private sector has been amazing. For instance, Junior Marzuka, he not only put them together, he placed them in containers, he trained technicians for the Ministry of Health, he used his truck to transport them in the countryside, he used his own crane to move them to a platform, and that was really, he did it with great joy. This was unbelievable. We could not have done it without him. So now each major hospital is fully equipped with a capacity to treat patients beyond COVID. Now, with the private sector, we know that major items were transported 750 times. Imagine heavy oxygen tanks, 100-pound tanks, 1,000 of them being transported all over Haiti. Hence, we have increased testing capacity. We have increased dedicated COVID-19 centers that are fully equipped with trained staff while monitoring the course of the epidemic. And I'm happy to report that as of now, we have 9,229 cases, 232 deaths, with about 2 to 8 cases per day. In contrast, the Dominican Republic has close to 140,000 cases, 2,313 confirmed deaths, just about 15 more cases than Haiti, and 10 times more deaths. So altogether, we have set up a beautiful machine, a unique partnership with the Haitian private sector, the Ministry of Health, and various UN agencies. Now for accountability of funds received. FAME, the foundation directed by Lionel Thionier, has been fully audited by a certified firm, and the report is available and was sent to many donors. There were about $500,000 remaining in the account, and it's planned to be used the following way. Some of it have been used to purchase additional power generators because you need electrical current to power oxygen generators. In addition, we plan to set up an oxygen station in Port-au-Prince so that we could fully provide oxygen to hospitals. You have to realize that the private sector import oxygen from Trinidad. They don't produce oxygen in Haiti. So if there is an embargo or any issue, hospitals are left without oxygen. With this setup, that is a consortium, the private sector, Ministry of Health, and UNOPS, which is a UN agency, it will be guaranteed that oxygen will always be available. Now, the government purchased, before I was in charge of the commission, 106 ventilators and CPAPs from China, and there were about 33 donated by USAID. Very few people know how to use them in Haiti. Fortunately, we didn't have to use them. But as you know, they are very handy and will be very helpful post-COVID. So with the support of University of Miami and CDC, we will have definitely training of the College of Anesthesiologists in Haiti. And this college will act as trainers for the rest of the country. They will manage to train all the staff in the various hospitals nationwide. So this is a huge improvement on where we were. It's estimated that the investment made by the government and the private sector is the largest in the health sector in over 50 years. And this will have a huge impact on healthcare nationwide. We may also use part of the funds to add to a much needed seroprevalence study nationwide. Why do we need to do that? It's important to know how many Haitians have been exposed to the virus. This perhaps would explain why we've been preserved in some ways. So the experience that we have will be published. This unique partnership can be used again and again when the country faces other major disasters that I'm sure will be coming. I will stop here for you to ask questions. I'll be very happy to answer any one question that you have. Thank you very much for your support.
Thank you, Dr. Pop. If you would like to ask a question, please go to the icon at the bottom of your screen that says participants. Click on that button that says participants, and then you can raise your virtual hand by clicking on the raise hand button. And I think, I know Sam, I'm gonna start with you because I know that you had written me earlier and had a question for Dr. Pop. So I'm gonna go ahead and unmute you now.
Yeah, no, this is for Haitian Times. I'm just wondering if you're seeing any uptick recently in cases of COVID-19, and if there's any, is there any concern of that happening in the future, as it has in many places throughout the world?
Okay. Honestly, I don't think we'll have a second wave, but I cannot guarantee 100%. So this is why we'd like to do that seroprevalence study. The reason why I'm saying this is because we have reopened the airports, we have reopened the economy fully, we have reopened schools, and we have not seen an increase in cases. And normally, at the end of October, beginning of November, this is when we have respiratory virus infection, such as influenza. We are seeing influenza, but we are seeing very few cases of COVID-19. So I hope I'm right, but if I'm not, I think this time we are ready to face it. But I hope that I'm right and we will not have that second wave.
Gotcha. Thank you. And are your efforts to educate the population continuing in the country as well?
Much less, because the population is living a different reality, and they only believe what they see. So if we keep telling them that COVID is a bad disease and they are not seeing any COVID around them, uh, they will think that we are lying to them. So at this point, they're still wearing masks, but very few people do. But all the activities uh, are taking place back the way they were previously.
Gotcha. Thank you.
Great, thank you, Sam. Again, if you have a question, you can put it in the chat to me, or just raise your virtual hand. Here's a question. Dr. Pop mentioned that the collaboration with the National Lab will continue. Can you say more about that collaboration?
Yes. I must tell you that there was a beautiful article in today's Le Nouvelliste about field epidemiologists trained by CDC. Unfortunately, people don't know what's happening at the Ministry of Health. The ministry does not provide the information, but from the inside, I can tell you that this is a very nice department, what they call DELR, Division of Epidemiology and Laboratory Research. The national lab headed by Jacques Boncy is very well equipped. This is where CDC conduct most of their studies. But most importantly, right after the earthquake in 2010, CDC trained over 200 field epidemiologists nationwide. So every department has a couple of them. In addition, they've set up a network of 676 centers that report every single week on infectious diseases, whether it's cholera, malaria, tuberculosis, HIV, AIDS, etc., and COVID-19. So I think Haiti is unique in the region to have this, and we are very grateful to CDC for having done this. As you know, they are the best at training field epidemiologists, and they did a very, very nice job. So you have very young Haitians, fully dedicated, because I met them, totally capable of doing the job. So the collaboration that we'll continue to have is one in the seroprevalence study that we will be doing, because it's something we are doing together. In addition, just today, we ordered with Jacques Boncy additional reagents for both laboratories. In fact, I'm just telling you that they are different because they are handled differently, but they operate in unison. It's really beautiful to see two different labs operating with exactly the same goals and dedicated people on both sides. So it's very, very, very nice. We don't just work with the laboratory, we work with the Division of Epidemiology, because we control two sites at the border with the Dominican Republic, Guanamet and Malpas. And I can tell you the majority of problems that we have come from the Dominican Republic. There are about 4,000 people crossing the border every single day. And the last time we tested people coming back, we found 6% PCR positive. So it went from 16% to 6%. But 6% of a large crowd is huge. So as long as the epidemic will be burning in the Dominican Republic, we cannot say that we are completely out of the woods.
Another question, Dr. Pop. This seems to have been an extraordinary success in terms of fundraising and execution. And how do you think that success can be reproduced in the future to face other chronic challenges in Haiti, or chronic challenges that are faced today?
Well, I think that, as I said, I think we have a formula. Mm-hmm. And the formula that has worked very well is engaging the private sector. The private sector is very generous, but they need to be sure that their fund will be used properly. As you know, there have been bad experiences in the past where people donated X amount of funds that disappeared and nobody knew why. So this is why we insisted on making sure that every dollar was accounted for. So this is number one. Number two, we have developed a beautiful relationship with all the UN agencies. And that was very, very nice. Imagine that those people at the UN, at a time when their family was exposed to COVID in their own country, they chose to stay with us in Haiti. And some of them became ill with COVID-19 in Haiti. So we've developed a tremendous bond with them. We've developed a tremendous working relationship. And at the same time also, we work very beautifully with the young leaders at the Ministry of Health. You have a lot of capable young women and young men. All they need is direction. And once they have the direction, they will produce an amazing job. So I'm fully confident that Haiti can do the job if the means are available.
Thank you. One other question, or another question, is how do you explain why COVID has been rampant in the Dominican Republic while in Haiti it has been quite stabilized?
Well, I think the Dominican Republic had a phenomenon similar to New York City. The Dominican Republic, in contrast to Haiti, that has been closed to tourism for a number of reasons, has been very open. In fact, tourism represents 30% of their income.
Hmm.
They have over 30 flights a day from Europe, including all major countries in Europe, particularly Spain, where the epidemic was huge, Italy, also where it was huge, and France. They also have direct flight with mainland China and direct bilateral relationship with mainland China. So I think that the Dominican Republic was bombarded by cases the same way New York was, and probably much before those cases were recognized in Haiti and in the Dominican Republic. You must remember that they have resort all over the Dominican Republic, and many people go to have sexual tourism. And this is a very quick way to expand COVID nationwide in every city in the Dominican Republic. So I think that this is probably what happened. Now, there is a difference between being infected and severity of the disease. If you look at the number of people who die in the Dominican Republic compared to the huge number of cases they had, it's relatively small. It's a small percentage of deaths compared to large number of infected people. So the entire Caribbean, whether it's Cuba, Jamaica, Haiti, the Dominican Republic, we've been spared in some way of the type of disease that killing machine that we are seeing in most of Europe and in the US, and also, strangely, in Brazil, Peru, and some other Latin American countries.
Another question, Dr. Pop, about vaccines. So there are apparently 3 viable vaccines that are coming to market. And what do you think will be the impact or the use or the need for vaccine in Haiti?
That's a very good question. And I'm sure that the Ministry of Health will send us that question in the next few days. I don't think it's a priority right now for Haiti. I think that there are other countries where people are dying and the vaccine should go to them first. Now, the priority for Haiti would be people with comorbidities, people who are older than 65 years of age, and then the medical workers. When the time comes, I think that we will need the vaccine probably because most countries, I guess, will require that you have a stamp on your passport that you've been vaccinated before you can come inside their country, very much like yellow fever. I think this is probably what will happen. And since this disease is likely to be with us for at least the next 2 years, people will need the vaccine to travel. But if Haiti population has enough of them have antibodies to the virus, I think at least that second wave will be spared that second wave, and we would not need the vaccine immediately.
Okay. Are there any plans to publish this successful pandemic management approach? And someone had commented in the chat that surely the CDC and other similar public health agency might want to model it in their respective contexts. So what are the plans for publishing this approach?
Okay, there are a couple of things that are ongoing. The scientific cell, and part of that as well, has prepared a document indicating their experience with COVID-19. And as you may know, many of the recommendations for schools, for hospitals, for cadavers, how to handle cadavers, etc., were made by the scientific cell and then reviewed by the commission before they were adopted by the Ministry of Health. So this is in the plan. We also, at the commission level, planning to report on the success of this experience. I must tell you, I was very scared, as you can imagine, early on, to be in a country with such a weak health system, confronting such a huge threat. But fortunately, it went well. Everybody did their job, and I think that this can be used as a model. So we plan to do that as well.
Okay, thank you. In the coming year, do you think that there is going to be substantive change in terms of the relationships between Haiti and the US, particularly in terms of collaboration on health-related issues?
Well, I think that collaboration has been very good with the US. There is ongoing collaboration with CDC. CDC is in Haiti. They have many US staff implanted in Haiti. I think they're doing a tremendous job. Haiti is one of the few countries that has a website where you can know at all times how many cases of HIV we have, how many are under treatment, how many males, how many females. So this is all the work of CDC. So I think that we can certainly increase the collaboration, not just with the US, but also with other countries like Canada, France, Switzerland, and others.
Okay. We're coming up to the top of the hour. If anyone else has a question, if you want to raise your virtual hand or shoot me a question in the chat real quick. Yes, there is another question coming in right now. You can just hang on a sec, please. Akanksha, why don't I just unmute you? There we go. Akanksha, why don't you ask your question?
Hi, Dr. Pap. I was just curious to know if you have seen kind of a visible impact of COVID on general patient attendance at JESCIO. Like, have there been any changes in presentation or retention and care?
This is a superb question because I think that we've suffered more from other health programs due to COVID than to COVID itself. For instance, we are seeing more maternal death because pregnant women did not deliver in hospitals. We are starting seeing cases of diphtheria because not enough children were immunized. We are also seeing less adherence of patients with AIDS to life-saving antiretrovirals. Patients with TB don't adhere as much to their treatment. We are seeing more cases of malaria, although malaria was at a very low level. So if I put this all to more cases of malnutrition. So this is all very well documented, but we need quickly to react and make sure that those programs are back on track.
Okay. Well, we're right up at 9 o'clock. Dr. Pop, I want to thank you very much for your time. I want to thank all the participants who signed on tonight. I know it's a little bit late. But we very much, again, appreciate your interest and your support over the last difficult time. And we hope you have a wonderful evening. Thank you again for joining us.
Thank you to all.